All right, good afternoon, everybody. How are you doing? We're going to get started on our webinar now. Today, joining me, I'm Scott from Revize. Today, I've joined with David and Janet from Oswego County, New York, who are part of their communications team, who will share some of their stories today on what they've done throughout this crisis, how they've used their website, and other communication tools as far as getting the word out and keeping the people in their communities informed. I'd also like to congratulate them because they recently were two-time gold award winners of the Horizon Interactive Awards for their website, which was done by Revize. So congratulations, Janet and David.
Thanks.
Yeah, thank you very much.
So I'd like to start off. Can you guys just introduce yourself, and then we'll get into the topics of discussion.
Okay, I'll start. I'm Janet, and my job is Tourism and Public Information Coordinator for Oswego County Government. And our office is part of the Department of Community Development, Tourism, and Planning. One of our responsibilities is doing public information and public education for all the departments of county government.
Okay, great.
So I work with Jan. Actually, I work for Jan, and I manage the digital and website, anything digital communications related. So all of our social media channels, and I also work with the overall county brand and marketing in that way. So
Great, thanks. So first thing, Janet, I don't know if you want to answer this question, but how has things been for you guys in Oswego County as far as dealing with this crisis?
It's been pretty intense. We started in the middle of March. As part of our responsibilities, we've always worked closely with the health department and administration and other departments of the county, elected officials, and just about all the infrastructure. So in the middle of March, the county pulled together a response team, and we started having daily briefings in the morning with probably about 25 different agencies represented, including law enforcement from the state as well as local officials. And basically we went around the room and reported on different issues, problems that were coming up, different activities that the various departments were involved in. And from that, we've been continually involved, and all that information helps us frame our messaging and determine what the needs are as far as communication, dealing with rumors, main messages, that kind of thing.
Okay, great. Let me switch over. I'm going to show you guys their website. Sorry about that. So David, how about on the digital side of things, how have things been going for you?
yeah, I mean, we kind of follow the overall messaging. So once that's determined, then it's about finding different touch points and, getting the message to our audience. And I think, being aware of that audience is kind of at the heart of all of this. Where do people have access to what features? What do our following look like on different social media accounts? When do we post things? What's the priority in posting and getting out the information, all of that. So it was definitely hectic for sure, but we're kind of just learning as we go. I think that's the main message here that we're trying to get across is we definitely don't know everything that we're doing, right? We're learning as we go, just as everyone else is. And hoping to share some of those experiences of what worked and what hasn't. So
great. So Jan, I know one of the recent things that you guys did was develop a COVID-19 specific page to get information out. Can you speak on that a little bit more?
Yeah, that is a page on our county health department's website. And we've tried to refer all our messaging back to that page as a source of information. So all of our news releases that we issue are posted on that page. There's a dashboard. There's several links to credible information, both from the State Department of Health and the CDC, and then there are sources of information that we find that we think would be helpful for citizens.
Of course. All right. And how else have you implemented the website, and which tools and features have helped the most when getting that information out? I think, David, you can maybe speak to that.
Yeah, I can try to tackle that one. I think one of the main things here that we realized pretty early on, and in some ways we're lucky enough that we had implemented some of these things, is that it's not just about the actual the features themselves as much as it is about having an easy way to implement processes. And a good example of that is the health landing page that Jan mentioned. So if you go there under departments,
if you want to share your screen,
yeah, I'll just share my screen here. That will be easier. So if I go to my health site here, and I'll go to a landing page first. We developed this with the health department, many months ago, and this is basically a standalone microsite. And because we had so many editors over there already trained, and they understood how this site worked, and not only how it worked, but why certain pieces were where they were and the way it was. So basically the strategy, then they were actually the ones who came up with the idea of creating this landing page. So I'll go there. It's under information, novel coronavirus. There are a lot of different ways to get to this page, but this is something that they set up pretty much immediately. And I think had we not had them trained and had them thinking ahead, we would have probably gotten to this point, but it would have taken us a lot longer, right?
Of course.
So this is kind of our landing page, and again, it's the processes that are in place. So we have a friendly link right here. You see our long URL, but if you go to health.oswegocounty.com/COVID-19, it'll take you to this page.
The same page.
And that sort of strategy behind the scenes of this is going to become the call to action for all of our news releases, all of our when we go before the media, any of the videos we're producing, this is the landing page that we're basically pushing out there. So
okay. And on the main site, what have you guys done other than the
so over here,
site?
right, here's our main site. I think because we're streaming here, the video is not going to run as smooth as it usually does, but this is our main site. So we have our main news section, which is right here, and the strategy that we have going right now is all of our news, any departments throughout the county gets posted here. But in addition to that, we also post the health and the COVID specific ones to the health site. So if someone just wants COVID information, they go to the health microsite. But this is kind of all of our general information. And we have another section right here called current initiatives, which it's a section that we I don't think we totally understood. We didn't see a need for right from the beginning in some ways, but the developer that we were working with at Revize really kind of pushed us to use this because it's a way for us to kind of pin long-term initiatives. And it became a really nice area during this pandemic for us to pin our videos. So we have our latest videos, which take us to the YouTube playlist, our changes in government services. It became a place, if you will, for us to highlight kind of long-term messages.
Of course.
So.
And the emergency alert, do you guys have you guys been using that on your website?
Oh yeah, I was. Yeah, I don't have it turned on at this moment, but we have a feature which is the emergency alert feature, And we had it for both the health site and our main site. And it was really nice in the beginning because citizens weren't used to kind of going to these landing pages. So we just put a little alert up there for a while. And we also sent out notifications with that alert. But we've turned it off now because we're finding that so many people are used to kind of going to the landing pages that we've been directing them to. So.
Okay, great. And what about things, I know the current initiatives you found a kind of new use for that tool or that space on your website. Have you seen anything else that you haven't used before that you're using now or in a different way?
Yeah, definitely.
Than before.
Definitely. So one of them that we kind of pushed is if you go to our actual news section, the subscribe feature, we've actually found that we've gotten a lot more people interested in being notified whenever we post news releases. In addition to that, on our health site, we have the same exact feature, which is here on our main page, the bottom, our subscribe feature here.
Okay.
So that's been useful. I would say too, again, going back to that concept of pushing processes rather than just the features. There were a lot of other departments that we were able to kind of tap into. And one of the things I think we're really proud of here on our, again, going back to our main landing page, we built like a virtual dashboard, which we pulled in some folks from planning who have a lot of experience with this. Again, this isn't hosted by Revize, but this is actually a lot of the data is run by Esri. It's GIS driven, so real-time data, and this has been awesome for, I think, a lot of our communities. Just they feel like they're seeing the data in real time, and in fact they are. I mean, they can pretty much access it as soon as we can. So
yeah,
that's been really nice for sure. And there's mapping.
That's great, and the mapping integration. And I know New York, I know you guys aren't in the city, but I know New York State and New York City has been a pretty hot spot for this. So I just want to give everybody else the idea of maybe they aren't doing some things that they could be doing with their communications. And just we're all kind of in this together. Nobody really knows the right answers on this. So hopefully that this can help at least get people an idea of what they could be doing or things that they should try in the future. So that's great.
This feature especially has been really helpful for us with reaching the news media as well, because they're accustomed to the time that we're releasing the daily updates, and they're using that as a source of information as well. So that's exactly what we want them to be doing, to be going to a credible source and not, not just relying on let's post it on social media.
Yeah, how is dealing with misinformation at a time like this and keeping people on those official channels?
Yeah, there's well, we have two Facebook pages. The health department has their own page and the county government has one. And we have a team from our department and health department that have been trying to monitor both those pages and get control of rumors. Also, if there's questions that are trending that we can get ahead of and try to post correct information out there, that's been really helpful. It has been a challenge, but there's been positive aspects to it too. And we find that sometimes citizens kind of self-monitor it. So some people are just looking for the adequate, credible information, and they kind of self-monitor some of the negativity as well.
Okay, and Janet, what else have you found that's been successful or not successful that maybe previously worked but doesn't work anymore, or is just what are some of the challenges that you guys are facing?
Well, one thing that's been successful is the teamwork within our department and partnering with other departments. We're pretty small and we're accustomed to working together as a group anyway, but nothing like what we've been facing, over the past 6 or 8 weeks or so. And we've been able to work together to brainstorm different strategies if there's issues that we feel we're not adequately addressing. So I would say that our communications plan has definitely been flexible and evolving, but relying on partners and strengthening the partnerships that we already had has been really positive. From a public information standpoint, because we are a pretty small county, we're governed by the Department of Health as well, and HIPAA laws on what type of information we can release. So there's times that we aren't releasing as much identifying information as some of the larger counties around us do, and that is a challenge, but we have to be really cognizant of protecting our patients' privacy, and we've all tried to stay on the same page with that.
Of course, great. And David, what could you say about priorities? I know that this COVID pandemic has really been taking priority pretty much over everything in the last, like Jan said, 6 to 8 weeks for pretty much everybody in the country. How are you dealing with having to handle other responsibilities and other important information that people still need to hear?
Yeah, right. Well, we do a lot of overtime.
Yeah.
That's one thing. I would say it's kind of coming under control a little bit, in that in the beginning it was kind of the Wild West, in that we were still setting up a lot of these processes too internally, but now we have some structure. For me, the priority question has been in the back of my mind every time I go to do something, just because our resources and time are limited, and we have to think about, okay, who are we reaching? Are we reaching everyone, all demographics across the county, all townships? Are we really doing our best? And if not, where are the places that we're missing it? And how can we take what we're already doing and making it more accessible? And I think I want to touch on the video stuff we've been doing too, because this has been a huge project for us. So this is our government YouTube, and we've created a playlist, a COVID-19 playlist here. So when you go here, we post these videos about 3 times a week. In the beginning, it was more often than that. Monday, Wednesday, and Friday at minimum now. Yeah. And you can see here all the videos we've done so far since March 21st. I think this has been a huge piece for us, because we can kind of always point back to it when there are questions. And again, you're thinking about when it comes to social media, you're thinking about content. It's usually a question of content. What are we pushing out? What are we producing? And this has been a nice foundation for us. We can turn back to it when we're creating other videos, but we can also include links to it in most of our playlists. If there are questions about specific topics, chances are it's been addressed at some point, so we can point back to these videos as well. But also, it's something that citizens can kind of rely on. They, in the beginning especially, we found that thousands of people were coming to our site, looking at the analytics, that had never been there before, and people were starting to follow and like our Facebook pages, people who had never interacted with us before at all. And having this piece that was consistent, that we were pushing out with good, clean, clear messaging, that was consistent with that larger messaging that Jan mentioned, has been invaluable, I think. So
it's been really helpful for our partner agencies too, because as I mentioned, when our what we call our response team includes many different departments of the county, but also partners like our local hospital and law enforcement and agencies like that. And so if there's trending topics that they need to spread the word on, we invite someone in as a guest. So just about every video that we record has a guest, plus we always have an educator from the health department and our legislature chairman. And then if there's something urgent that comes up that we need to address, we can always schedule another one and get them posted right away. David's done a really phenomenal job of getting them posted. We send the files to the broadcast media and also the links to YouTube, and everything we do as well. Like all our news releases and links are going to our county employees, as well as the legislature and elected officials across the county. So it's really helped with the messaging and let people know if there's changes in services and things like that that they need to be aware of.
Of course, of course. I know everybody's kind of all in this together right now, as far as different departments who maybe didn't used to work as closely together, but now kind of have to, because this has taken over pretty much everybody's life, and even a lot of people working from home that aren't in the office getting together virtually. How has that been, keeping those communication lines open with those other departments?
Well, for us, sometimes we're working from home and sometimes we're in the office. We try to switch back and forth. I would say through the briefings that we're doing and also through email, we're able to address just about anything that we need to, either that or through phone calls. But it's definitely helped to strengthen partnerships that we already had.
What's some advice that you would maybe give somebody else, or even give to yourself, before this had happened?
David, do you want to start on that?
David, you can start on this.
Sure. There were three things that I kind of thought of actually for this, and I wrote them down here. I think one of them we did well, and I don't take credit for this one at all, but and I think maybe we got lucky to a certain extent, but I think when you're coming up with an initial communication strategy, you have to make sure it's flexible, and that means it can respond to not only the messaging but also the situation. So that's really important, so that you don't get stuck in some sort of a rut and things change a little bit and then you wonder, okay, we have to come up with a new strategy, a new style of video, whatever it is that we're going to kind of rework. It's nice. People like to get in the habit of things, and I think if you can come up with a good idea from the beginning that's going to work for the long term, I think then that's the strategy that's going to work. Another thing I thought of was just considering, all of your data and analytics, so that and this goes for demographics too, right? So that you're considering people in the county who might not have access to internet, or might not be coming on to, maybe they don't have access to Facebook, maybe they're not used to watching videos online. So trying to hit all those touch points and create new ones if that's what it calls for. The goal is to get relevant information, useful information to the public as timely as possible. And I think in this day and age, that also means reaching the public directly. You can't ignore the media and the partnerships that you're supposed to have with them either. They play a really important role. But I think when it comes to especially timely information or information like this that affects so much of our everyday lives, then we have to be reaching citizens directly. And then lastly, and this is one I think we're still working on too, but looking at communication as a marketing tool and thinking about the future, right? I think we can so easily get stuck in this thought process of, well, we're getting messaging out, which is true, and that's a huge part of our job. But I think, there's a way to synthesize a lot of the things that are happening and create a larger message. In many times a more hopeful message. We can do a lot as a central communication team to in the actual rebuilding after this passes, and to keep public morale high, so that people feel that by listening to the different restrictions, they're taking part in making our community that much safer. So I think we're kind of just getting into that now and thinking about, okay, the future and what does this all mean for businesses and restaurants and who's been affected and how can we reassure them and what can we make available to them. Of course, we can't really get into the actual programming, but how can we take all these pieces and put them together to tell a larger story?
Another thing I would add to that is we've done probably almost at least 150 news releases when this started, and we just issue them as the need arises. So every day we do a daily update report that's formatted, but we also talk about changes in services, but we tried to be creative as well. So we did one about a volunteer group that's been making masks in a really rural town in our county. And someone from our emergency management office went there and got some video, and we were able to use that. And the media and the Syracuse market, TV market, picked up on that and followed up on that. Then we did one on recovered patients and interviewed a few that were willing to be interviewed and share their story. And we got a lot of positive follow-up with the Syracuse and other area news media on that. So we don't expect that every news release that we do is going to be picked up by the media, but we know that we're definitely publicizing things through the website and through the local daily papers. Use just about. They're really great partners in helping to use what we're sending out. But we try to be creative and flexible too in what topics we can address that people will follow up on and do their own story. And so that's been really helpful as well.
That's great. That's great. Do you guys have anything else you'd like to share before we kind of open this up for some questions from the audience?
One thing I failed to show when we were talking about features, and can you still see my page here?
Yeah.
So this is the main coronavirus landing page on the health site. We just built this in, which is a feature through IBM, and I need to mention this because I think it's a pretty awesome tool. So it's actually a chat box where we can kind of interact and ask Watson, which is IBM's supercomputer that it takes into account a lot of real-time data and also artificial intelligence to read what's behind the question so that it's not just like a Q&A here. And I think if you go to our site, health.oswegocounty.com/COVID-19, you can kind of play around with that. It's a pretty awesome feature, and it was one of those things where we didn't feel like we had time to implement it, and we have a hotline here. You can see the number. That's New York State one, but here's our Oswego County hotline where you can call and you can actually talk to someone at the health department and ask questions, and they field a ton of calls. But implementing something like this so that, again, there's another touch point to our larger communication strategy where maybe there are people who don't want to call and they don't want to talk to someone, or maybe they think they have a really simple or seemingly silly question that they feel more comfortable just typing. So thinking about things like this and being willing to adapt, I think this is something that we just implemented about a week ago, and we're still kind of learning how it works and how do we feed it information and make it relevant. But again, it's just another example of something that
that seems like a really great tool.
Yeah, reverse search.
I posted the link down to your website in the chat if anybody wants to follow directly to that. Anything else, Jan, before we jump over to some questions?
The only thing I would say is we've been really fortunate to have great leadership and keep the lines of communication open with our administration and elected officials and the other departments. And that's something that will carry us a long way when we're through all of this too.
Of course. Great. Well, thank you guys for the information. And then if the audience, if you have any questions, if you could post them in the chat and we can try to get into that for you guys. If there are any questions. If not, David, how have you seen, I know you kind of touched on it, the digital growing, like your Google Analytics for your website and your Facebook and YouTube analytics. How have those been affected during this time?
Honestly, it probably goes along exactly with the actual curve of people being infected. I mean,
Yeah.
like that's the trend we noticed when we pulled analytics just now on YouTube. We pulled them, what was that, Sunday, Jan, where and again, we haven't graphed it, and there are a lot of variables here. We don't know if, you know, some of them are based on actual topic interest or just people had time at certain points in the month. There are a lot of variables, but we did definitely notice that in the beginning there were a lot, and then it kind of came to a head when people were used to interacting with us. It's definitely on the decline now, and something we're aware of, and I think it's like, how much do you want to address that? I mean, the point isn't to run the videos for the foreseeable future. It's to get people information, the information that they want. So, you know, it's an open conversation. I think something that we're just, you know, look at the analytics, take that into account with some of your own hypothesis about why people are interacting, and then, you know, create your messaging and put that messaging on the right platforms based on that.
Of course. Tanya, thank you as well. Thanks for being here. Does anybody else have any questions? I hope this was informative for you guys. I don't want to keep David and Janet too long. I know they've got important stuff to do. So if there's no more questions, I guess we'll end it here. If you guys have anything else to say before we go.
I say good luck, everyone, and hang in there.
Of course.
Yeah, ditto. I mean, don't feel alone if you're on a communications team, even if it's a small team. I think there are no right answers right now, and in many ways, we're on the front lines with healthcare providers. Maybe not in the same way, maybe not exposed in the same way, but I think what we're doing right now is, if you think about it as a service to the community, then that provides a lot of motivation and to do your job properly, and to find new ways to get that information to people, which people appreciate. I mean, it's
of course.
their job, so.
Of course. Well, I want to really thank you guys for taking the time out of your day to do this with us, and you know, keep doing what you're doing. And everybody out in the audience, thanks for attending. I hope you found this informative. I hope everybody's staying safe, stay healthy, and we'll all get through this together.
And thank you, Scott, for shepherding this along.
Thanks, Jan. All right, bye, guys.
Bye.